normal. Oh, sorry, just a second. Yeah. So that is why it is very important to know exactly how to take care of your eyes optimally. So I will start with a small introduction to the anatomy of the eyes so that we know what we are looking at and why certain problems arise in the eyes. So to the left, you will see that it's the picture of the external part of the eye. We all know that they are the eyelids. These are the eyelids. These are the lashes. This is the central black part in the eye is called the pupil. This is a reflection. This is a transparent covering of the eye called the cornea. This is the white part called the sclera. And this is the brown or the blackish part, or some people have different colored irises. That's the iris. Now, more importantly, we need to know a little bit, especially related to the constant use of computer over long hours. We need to know understand some amount of anatomy of the inner part of the eye. Okay, so this is the anterior part of the eye and this is the posterior part. Now, what is important in the anterior part? This is the transparent covering of the cornea. This is your pupil. So this is the pupil. And this is the lens of the eye. Now, what important structure we see here is the ciliary muscle. This muscle controls a lot of things, which I will be talking about later. And this, we should all know about the ciliary muscle. And then, of course, this is the back part of the eye. This is the optic nerve, and this is the retina on the back of the eye. That is like the film of the eye, like the film of a camera. The retina is the film of the eye. And the retina and the nerve, these two parts are basically like a part of the brain. They connect the eye to the brain, and that it's basically nervous tissue. So it's important to know that once this part of the eye is damaged, it is very difficult to get vision back or replace this part of the eye as of now. Okay, so most common problem that we see with eyes is the vision disorders. So refractive error checkup is the most basic part of an eye examination, and we should understand better what are the different kinds of refractive errors or vision disorders. So when you see this top eye, in normal vision, basically, these are rays of light coming from far away. They focus as a single point at the retina. This is when a person has no glass number. Now, if a person is short-sighted or has a minus number, what happens is these rays essentially get focused in front of the retina. So you need a concave lens to focus these on the retina. Then in the lower left corner, you see this refractive error called hyperopia. That is basically a people who have plus numbers. In their eyes, the eyes are slightly smaller in size compared to the myopia. Because they are smaller, these rays of light coming are focusing behind the retina. So you need a convex lens to focus them back on the retina. And something called as astigmatism is also there, in which the shape of the cornea or the shape of different structures that bend these rays of light, it's irregular, not like it is less closer to a circle or a sphere. So different parts of the eye tissues, they bend the light in different ways. So they form multiple points of focus, and that is why you get a little, say, slanting kind of vision, or blurring of vision in a particular axis, you can say. So that is astigmatism. These are the basic vision disorders. Now, another phenomenon that we need to know is called as presbyopia, or it is a near vision dysfunction which happens physiologically. That is, it is not a disease, it is a normal aging process where after 40, the near response of the eye is affected. Now, this is where we talk about the ciliary muscle. So essentially, this is the ciliary muscle, which is very important in focusing for objects that are at near distance, or even like your laptop or your phone screen, or when you're reading something. Now, what happens is in any individual till 40 years of age, this ciliary muscle is very strong, and it contracts and increases the size of your lens, and essentially all the rays of light coming from a near object get still focused on the retina, and that is why you can see clearly for near. Now, what happens after 40 years, physiologically or normally, this muscle becomes weak, and because of that, these rays of light are not able to focus on the retina, and you get a near number. So once we are familiar with these concepts, we are better able to handle, or we are better able to understand our own needs, like what is essential to get clear vision. Okay, so now focusing on the main topic of today, that is like computer vision syndrome. So we get a lot of patients nowadays who have who are complaining of eye strain, headache, and difficulty, in working on the screen for long hours. So it's basically, this condition is a condition resulting from focusing the eyes on a computer or other display device for uninterrupted long hours, as a result of which the eye muscles are unable to recover from constant tension required to maintain focus on a close object. So I described earlier that when you want to maintain focus on a close object, the ciliary muscle has to contract. Now you can imagine, if your arm is contracted like this for over 6 to 8 hours, this muscle is going to tire out. So similarly, the ciliary muscle is tiring out and you're not getting, that is how your eyes are hurting, your head starts hurting, you're uncomfortable. So naturally, it's difficult to work for so long. So that is what we are talking about. That is the constantly overworked ciliary muscle causes headache and eye strain. Now, second most important thing in computer vision syndrome that causes a lot of discomfort is basically when we look at a computer screen for long hours, we tend to stare because we're concentrating on what is being done. There's a meeting going on, there's an important presentation, there's a coding calculations to be done, and you tend to stare at the screen. It has been shown through research that your blink rate decreases substantially. So what happens is that basically God has created this layer of the tear film on the eye. It has three different layers, three different components. This tear film, when maintained normally on the eye surface, gives you clear vision. Now, the minute you stare, what happens is the tear film dries out. That is why most of the people working on computers have this thing called dry eye. Now, the tear film has three different layers. Okay, the innermost layer is a mucinous or sticky layer, which is secreted by this part of the eye, the conjunctiva. The middle layer is a watery layer. So this watery layer sticks to the sticky layer and stays on the eye. That is secreted by this lacrimal gland. And then it is covered by, see, the beauty of it is that God has made it in such layers that it can actually stay for longer hours on the eye. It is covered by this oily layer or a lipid layer, which is secreted by glands called as meibomian glands in the eyelid. Now, these lid glands, they get pumped when you blink frequently. These lid glands, they get pumped and the oily secretion comes out. What happens is when you stare for long hours, then these glands, they get blocked. Because they get blocked, this oily layer doesn't get secreted and this watery layer evaporates. So the physiology is, the working of the tear film is lost, and that is why you get even more eye strain. Burning, redness, dryness, all these things get exacerbated. Now the third, so this is a picture of the meibomian glands. You see these small whitish dots at the lid margin. These are those glands that secrete the oily layer of the tear film. Now the third problem is that there's constant high tension indoor activity going on, and there is no time for outdoor activity. Now there have been studies that have proved that outdoor activity is the only way, especially now in children also. If you want to avoid development of a minus number in the child, avoid the development of myopia, then it has been proved that if the child spends at least 2 hours in outdoors playing some game or just spending time outdoors, this has proven to delay the onset of myopia in those children. There is no other method of preventing myopia that has been studied till now. Now, why outdoor activity is important is because when you're outdoors, firstly, your exposure to UV light, the kind of UV rays that you're exposed to, those are different. Secondly, when you're outdoors and just going for a walk, your eyes are not focused on any object. Plus, if you are lucky enough that there is greenery around you, that green color and not focusing on any object in particular helps relax the eyes immediately. So this is a major problem that increases the computer vision syndrome symptoms. So now what can we do to reduce these symptoms? What can very basic things that can be done so that we are more comfortable at work, so that our productivity increases? Firstly, a regular eye checkup is a must, at least once a year if the eyes are absolutely normal, and more if required or advised by your ophthalmologist. Secondly, if you're nearing 40, go in for checking your near vision, get the presbyopic correction and use the glasses. That will greatly reduce eye strain. Thirdly, these are the few rules that we tell each and every patient who comes with these signs of computer vision syndrome. You need to blink frequently when using the computer screen. I tell my patients to keep a post-it note near their laptop saying that blink frequently. That's the only way you remember it. Then using artificial tear substitutes. Now, artificial tear substitutes are of multiple types, but you need to get a complete eye examination if you're suffering from dryness to see which exactly layer of tear film needs to be compensated, which one is deficient. So there are different artificial tear substitutes for the different layers. So your symptoms will decrease depending on the kind of art, if you're using the right type of artificial tear substitute. So it's not just a blanket, any artificial tear substitute that you can use. Thirdly, another point in that is that you need to follow the 20-20-20 rule. That is, every 20 minutes, you need to look at something at least 20 feet away for 20 seconds. So you typically tell my patients every half an hour, you put an alarm or some something on your phone telling you to just look outside the window, look at something green for 20 seconds, and that will relax your eyes and definitely help you reduce the symptoms of eye strain. Then using ice compressors or gel eye packs after work or maybe twice a day for 5 minutes or so can also help reduce eye strain. And if headache and burning of eyes or your symptoms persist, then it's better to see an ophthalmologist and get the problem solved. So that's about the general eye care that can be done. Now, a very common asked question is like, what should we do about using darker interfaces? So there was a 2021 review and they investigated therapies for computer vision syndrome. So definitely you can use a darker interface for your computer that helps reduce eye strain. Another important thing is not to use the phone uh, in the dark. Use it in a properly lighted room, because the phone is a very small screen. You need to really focus at a near distance, and the print and the fonts are the font is very small. So it is important to remember. And I always tell my patients that bigger screen, the better. So if you have a desktop that has a big screen that is further away from your eyes, that is better than using a laptop, and a laptop is better than using your phone. And always have the source of light behind you and falling onto your workstation. Those are some things. And there is also this 2021 review found that there is little supporting evidence for switching to bifocal or progressive glasses to reduce eye strain, or using blue block glasses. So blue block glasses are the biggest trend now. There are many patients who ask about them, and many people who are just using blue block glasses as well. But there was a multi-center trial all over the world, and they did these studies and found no proven benefit of using blue block glasses. You can or you don't need to always go in for progressive glasses to help you see better. Even using just, if you don't have a distance number, you can use a number for near and use it when you're doing near work, or you can go in for progressive glasses and give yourself some time to get used to it. But none of these 100% improve the reduce your eye strain. You have to go in for what minimum things that are needed. Like if you have a prescription for near, you use it. But using blue filter and all. So I tell my patients that if you don't have a glass number, there is no need to go for blue block glasses. But if you have a glass number, then, and you're going to use the computer for long hours, then you might as well get the blue filter with your glasses, but don't specially go and make it. Now, they've also found a low certainty of using omega-3 supplements to reduce eye strain. So omega-3 supplements are basically helping your lipid layer of the tear film being formed. So they are like lipid supplements that help formation of the oily layer on your tear film. So usually we give these for patients who specifically have these symptoms of dryness because of that gland dysfunction. It is not a blanket treatment for all. Now, there was another trial that was conducted to see whether macula is a part of the back of the eye or the retina of the eye. So there are certain supplements called carotenoid supplements, which help in the health, they improve the health of the retina, but they also, we don't prescribe them as blanket treatment to everybody. There are certain people who are prone to retinal diseases or who have high minus numbers, whose retina is weak. For them, they are really found to be useful. Otherwise, we still don't advise it as a blanket treatment for everybody who just uses screens. Another thing now to discuss, important thing is, again, like, this was the physical aspect of it first, where if you have glass number or if you have computer vision syndrome. Now, another thing is the mental aspect. So stress has known, basically what happens is with stress, it causes release of the stress hormones, that is adrenaline and cortisol, and this is happening over long periods of time. It's not like a single spike. Every day in high tension atmosphere, these hormones, the levels, they multiply, and this can cause different kinds of eye problems. So it can raise the eye pressure, just like it can raise the blood pressure, it can raise the eye pressure. So eye also has, the eye is like a balloon and it has pressure because of the fluid inside it, and I will discuss the effects of it later. But it can increase eye pressure, it can increase sensitivity to light. You can have eye twitching. So I get a lot of patients saying that, they have eye twitching. They have the lid gets, the lid is like vibrating of sorts. And then some people, if they are in really high levels of stress, they can even suffer from temporary blurring of vision or temporary loss of the peripheral field of vision. But we must remember that this temporary blurring and temporary loss is kind of giving you a warning, because they are seen because of decreased blood supply to the retina. So the blood pressure is increasing to such an extent that the it is causing raised eye pressure, and it is causing pressure on the blood supply to the eye, which causes this temporary blurring. So it can leave permanent effects in the eye. So we have to be really take it seriously. We have to take it seriously that stress needs to be controlled. Then it can also cause increased perception of floaters. So it doesn't really cause increased number of floaters. The floaters are there in the eye. It will not affect or cause an increase in the number, but your perception of those floaters when you're stressed out is more. So it again disturbs you and decreases your productivity. So, and now stress and glaucoma. So what is glaucoma? Glaucoma is basically, that is what I was talking about, that raised glaucoma is a chronic progressive optic neuropathy. So the optic nerve, or the nerve of the eye, which connects the eye to the brain, when that becomes weak progressively, it is called as glaucoma. Now, the only modifiable risk factor for the development or control of glaucoma is the eye pressure. So you can compare eye pressure to blood pressure. So when you have blood pressure, high blood pressure, it is called as hypertension, and it can lead to heart disease, stroke, other problems. Similarly, raised eye pressure can lead to weakening of the nerve of the eye, or that is called as glaucoma. So what happens is, when you're feeling overwhelmed and stressed, the eye pressure tends to raise, and that there is worsening of the field of there is worsening of the glaucoma, or the optic nerve becomes weak. Now, many a times, okay, I will discuss the details of glaucoma later. Basically, when you're feeling overwhelmed and stressed, glaucoma is treated with medication, basically to reduce eye pressure. So if you're already stressed out, we have noticed that patients tend to not take their medication. They tend to not follow up regularly, which causes progression of glaucoma. And it can also cause a sudden raised eye pressure and redness and loss of vision, that is called as an angle closure glaucoma attack. So these are very serious consequences that can happen in the eye. Now, what can be done to reduce the chances of this is basically having mindfulness meditations, in getting mental health counseling, and this can actually save sight. So we were discussing about ocular surface disease, basically dry eye and all, that is called as ocular surface disease. So when your tear film is not adequately covering the eye, it can cause a lot of problems, because the tear film covering the eye acts like a protectant to the surface of the eye. Now, when this tear film is deficient, it can cause a lot of swelling in the eye. There is redness in the white part of the eye. That is all inflammation. So this inflammation can cause that the white layer of the eye to shrink and fibrose and give you a lot of, because of that surface of the eye is not smooth. It gives you pricking, redness, watering, and you're uncomfortable. That is called as ocular surface disease. And with stress, there is definite flare up of ocular surface disease. And it's a vicious cycle. So your dry eye gets, the stress exacerbates the dry eye, which causes further emotional distress, which further worsens the dry eye. So we are caught up in this cycle and productivity decreases. So what can we do to reduce these stress-related eye problems is, firstly, get a comprehensive eye exam on time, use deep breathing techniques, practice mindfulness, and limit social media and screen time. And at least try to have an hour of outdoor activity daily. Just give me just a minute. Huh? Yeah, sorry. So these will help to reduce stress and definitely reduce the eye-related problems. Now, coming to some diseases that can again reduce our productivity, and some commonly seen diseases which we feel that, if I just want everybody to be aware of these diseases so they are not scared, and they can get right treatment at the right time. So one of the most common diseases, conjunctivitis, but we are not aware that there are different kinds of conjunctivitis. Just like we get any infection in any part of the body, it can be viral, it can be bacterial, it can be fungal, and it can be allergic. So similarly, this conjunctivitis or pink eye, or aankh ana, we commonly call it. It's very common infection. It comes in kind of bouts where many people are affected. So, and most commonly it is viral conjunctivitis that people are affected by. But because of stress and this high tension life that we lead, the viral easily becomes a bacterial conjunctivitis, because when you have a viral infection in your body, your immunity is depressed, and then additional bacteria can easily take control of a particular organ. So now, if you have a pure viral conjunctivitis, which is characterized by, you'll just have watering, redness, there's not very less discharge. And it's usually preceded by a fever or a viral cold. And this typically, in viral conjunctivitis, the only treatment is immediate rest. You need to take complete rest, which is very difficult in this day and age. But this only if you have pure viral conjunctivitis, you really don't need any drops. It just takes 7 days, but it goes with rest. But of course, in this day and age and the kind of life we are leading, it's very difficult and very rare to see just plain viral conjunctivitis. But yes, we do see it. It's not absolutely absent from the spectrum of disease. But more commonly, we see bacterial conjunctivitis, where the patient says that the eyelids are stuck, there's discharge, there's redness and discomfort, so that you need antibiotic drops. Now, why I'm trying to convey this is because just putting antibiotic drops for every sort of redness is not an answer, and we should not go to the chemist and ask for an antibiotic drop, or the chemist typically gives an antibiotic drop and we start putting the drops, and then when that does not work, we go to the eye doctor. What happens is, if you really don't need the antibiotic drop, it causes resistance, and the next time you use it, you cannot have it does not have the required effect. Now, another important type of conjunctivitis is allergic conjunctivitis, and this is a very, very common form of conjunctivitis, seen more commonly than the bacterial and the viral, frankly. And it is always seen when there is change of season, especially in the monsoons, when there is this acting up of there's more pollen in the air, or if you're surrounded by dust and you're you have a tendency for allergy. And this allergic conjunctivitis is also related to your stress levels, because if you are constantly under stress, you tend to have these episodes more. And typically allergic conjunctivitis is characterized by itching and watering and redness. And this needs treatment over long term. It is not like the normal viral or bacterial conjunctivitis, which needs to be treated for 1 week only. We need to identify this conjunctivitis and get treated. Usually the treatment lasts for a month. And it's important to complete the course so that you don't get recurrences. And another very important effect of the allergic conjunctivitis is that if you keep rubbing your eyes over long periods, it can lead to a disease called keratoconus, in which there is thinning of the cornea or the front of the eye. And this can lead to permanent decrease in vision, and it can be progressive. So very important to not rub your eyes whatsoever. Now, I would like to just introduce a few common procedures that are typically done in the eyes. Like many people undergo refractive eye surgery nowadays, and it's commonly called as LASIK. So LASIK is actually a type of high technology outpatient surgical procedure for permanent correction of refractive errors. That is myopia, hyperopia, and astigmatism. So there are different types of refractive surgery. So LASIK is actually one type of refractive surgery. Other refractive surgeries are like, you'll hear of names like PRK, SMILE, SILK, etc. These are just short forms of different kinds of procedures that are used to treat the refractive error depending on the condition of your eye. So there are certain myths about LASIK. That is LASIK. These are the commonly asked questions also, like whether it is painful. And many people are very scared that LASIK is not safe. And again, many people have the doubt that if I undergo LASIK, will it really cause, like, give me spectacle independence, or will I have to, because there are some people who actually get back a small amount of that number that they were corrected for. So the fact is that LASIK is virtually painless and it is done with numbing eye drops. LASIK is safe and FDA approved procedure, and it provides long lasting results. Only thing is that you should get enough checkups done before the refractive surgery procedure to make sure that um, to make sure basically that the procedure is safe in your eyes. So what are the prerequisites for LASIK? That age should be more than 18 years. You should have a stable refractive error for at least 1 year, and normal preoperative corneal thickness and corneal topography. So the scans that are done before the procedure should be normal. So basically what is done in LASIK eye surgery is basically numbing drops are put, then a flap is created. This is the normal LASIK procedure, the standard LASIK procedure. Then a laser is used for sculpting the cornea, and then this flap is repositioned. So in minus number, the cornea becomes flatter. Now, some other eye problems that I would like to throw light upon is, earlier I talked about glaucoma. Now, why glaucoma is so important? Because it is a disease like diabetes, which is, firstly, it cannot be cured, but it can be controlled, and diagnosing glaucoma in time is very important. In the right time is very important. So on the left, you see this. The left side is a healthy optic nerve. The right is an optic nerve that is affected with glaucoma. Now, in the early stages, basically what happens is in glaucoma, why it is important that you get an eye checkup is, the first picture you see is your normal vision, what you and I can see, everybody who doesn't have glaucoma. Now, when you are affected by glaucoma in the early stage, it is not your central vision that is affected. It is the peripheral vision. You see these black spots. So generally the peripheral vision starts getting affected, and slowly in end stage glaucoma, this is what happens. You develop tunnel vision. Now, because of this development of tunnel vision, it's basically in end stage. It's at this stage that the patient realizes that I have glaucoma, and then it's too late. So we need to diagnose glaucoma at this stage, in early stage, so that we can control it and maintain your vision for life. So that is why I really feel sincerely that everybody should be aware about this, so that they can get their yearly eye checkup and we can diagnose it on time. So there are different treatment options for glaucoma, going from drops to lasers to eye surgery. And what we should remember is that it cannot be cured, but it can definitely be controlled with timely intervention. Another important thing is if you have systemic diseases like hypertension or diabetes, these can affect the eye, and the eye is also a window to the entire body. So when you have when you have very high hypertension, this is the red picture of the retina of the eye. It has, these are the blood vessels, and these are the changes that high hypertension causes. And these changes can lead to permanent visual loss. And now these fine blood vessels are called as end arteries, or they are the finest branches of arteries in the body. These fine arteries are present on every organ. So if you are seeing, they can only be visualized in the eye. So if you're seeing these changes in the eye, that means there is a high chance of having the similar changes in different parts of your body. And it can lead to stroke, it can lead to brain hemorrhage, etc., etc. So the eyes can give you an idea about your whole entire body health. Similarly, with diabetic retinopathy, these are diabetic retinopathy changes which can reflect in different parts of the body. So that is why we need to be aware. So that is why we need to undergo a routine eye examination. So what does a routine eye examination encompass? Firstly, it's a refractive error checkup. That is, your glass number is checked. Secondly, we check your eyes on this machine called a slit lamp, where the anterior part of the eye is checked. Thirdly, the eye pressure is checked. Everybody over 30 years should demand an eye pressure check. It is a part of the normal eye examination. And the best way to do it is Goldman applanation tonometry, or at least, in simple words, you can say this blue light, that instrument that is attached to the slit lamp. That is the best way of doing it. That is the gold standard all over the world. And then lastly, you get a dilated fundus examination, or the examination of the back of the eye. We dilate the pupil and see the retina. This involves a complete eye examination. Now, for children specifically, I get a lot of frequently asked questions. That is, when should be the first eye examination? It should be as early as 6 months of age, and then once a year. How often to check the eyes? Annually if normal, and as often as advised by the doctor if abnormality is there. What is the most crucial time for vision development? So it's important from 0 to 8 years of age that we detect as many eye problems as possible and treat them, because the vision system develops till 8 years of age. If if there is any major refractive error or lazy eye, if all these problems are not detected, squint, if these problems are not treated before 8 years of age, they can cause permanent reduction in vision in one or both eyes. And is an optician visit adequate? So not in children at all. Children must get their eyes checked with an eye doctor, and a dilated eye examination and refractive error checkup with drops that relax the eye muscles is absolutely essential. Thank you.